This is Pete Pigeon. I am the Chief Operating Officer here at Hobbs Group Advisors. We are a financial planning firm focusing on wealth management, financial planning, retirement plan services, and tax efficient and tax smart financial planning for our clients. We have been doing these webinars now for almost a year and a half. So this is the second caregiving webinar. We have one from 2022. If you want to go back and look at that one, it's a little bit longer than this one. This is going to be a little bit more condensed, really talking about the 4 keys to making a plan, a caregiver plan. I'll just tell you what this is not about. This is not about long-term care insurance. I might mention it one time in this presentation. This is really about making a plan. And if you think about that, making a plan requires a proactive approach in advance of a need, right? So when we're talking about caregiving, we're not talking about what to do once, you're in your 90s and you need care. This is more about what do you do now to help prepare for the eventuality of needing care. If you are a child of an aging parent, this also deals with how you can help, or a family member for that matter, but ways that you can make that whole process better. That's what this webinar is about. And there are a lot of challenges with caregiving as far as monitoring people's health, the lots of decisions that have to be made, and the idea of staying in the house or not. These are all things, if you think about it, these are all eventualities, right? All of us will have these issues. We'll have to address these issues with our parents. So that's kind of where I am in my life. And then I will have these issues that hopefully my daughters will assist with, my wife and I. So this is really an intergenerational discussion, and really talking about 4 key areas, right? The first one, as I mentioned, you need to do some smart planning in advance. What do? You gather kind of important information, understand medicine, understand medical needs, multiple questionnaires to kind of understand the challenges that your loved one may have. And then really talk about the desires, right? And the priorities. Everybody has a different opinion on how they like to receive care, where they like to receive care. Do they want to stay in the house? Do they want to be in an independent living facility? That sort of thing. So talking to people, this is this is where I think financial planning's changed a lot, right? It used to be you don't talk about finances at the dinner table. You don't talk about these things. We advocate for these conversations because the more communication you can have, the better plan you can have, right? Oftentimes when you've got multiple family members, it's hard to have multiple CEOs. It's hard to have multiple presidents. You need to have one person who's kind of the lead. I think that, everybody can still be involved, but there's probably one person and oftentimes it naturally just kind of happens, right? But it is important to have one person who's kind of the quarterback. You need to discuss money. It's important, right? Caregiving is not free. It takes a toll both financially and emotionally. And as I said, you should be having this conversation well before you need care. So this says 60. Not everybody's going to have this conversation before 60, but certainly having it before 70 makes a lot of sense. Your plan must address medical, legal, financial, and personal issues. So a caregiver plan really talks about the what ifs. These are contingency. It's somewhat of a contingency planning, outlining the wishes and the priorities of the person who's going to receive the care, assesses the medical, legal, financial, and personal areas, the needs in those areas, and organizes it, right? So first of all, we'll talk about medical. What activities of daily living are of need for the recipient of care? Typically with long-term care, we talk about usually it triggers an event where there's 2 of 6. And dementia is the other one here not mentioned. So what sort of care is needed. Usually care starts with in-home care, and it's generally non-specialized, non-medical. Oftentimes deals with perhaps a visiting nurse or helpers or meal delivery or or live-in help if that is required. You need to understand insurance policies. Okay, you need to understand health insurance policies. Most of the time, the care recipients are going to be of Medicare age, so they'll be on Medicare, but then there's a supplement involved and there's a drug plan involved. Do they have life insurance? What happens a lot of times with insurance, especially life insurance and long-term care insurance, is you want to prevent those things from lapsing, right? If premiums are not paid, if bank accounts get changed, if someone forgets to pay a bill. I've seen some really crazy things where people have gotten solicitation phone calls and completely changed their health insurance because of their mental capacity really sliding. So you want to try to monitor those things. And then obviously you want to understand if there is long-term care insurance, you need to understand how the policy works, because that will be used more than likely for the care, right? To fund the care. Typically you want to get in-force illustrations of life insurance policies to ensure that premiums have been paid, understand what sort of benefits exist with that policy. Obviously the long-term care funding options, this is one of the things that, what resources are they going to use to pay for this care, right? Is it a form of insurance? Are they self-paying, self-insured? What sort of income sources do they have? All of these things are considerations when you think about care. Medicare does not cover long-term care. Medicaid can cover care. We're not going to talk that much about Medicaid because Medicaid requires a spend down of assets, right? Most of the people we're talking to have assets, and you want to figure out how to use those assets or preserve those assets. So Medicare, as I mentioned, everyone typically is on A and B. Then you've got different supplements in Part D. There's alphabet soup there. You want to understand how those work, what they pay, what sort of cost will the recipient have out of pocket, and make sure that you understand that those premiums are getting paid, because that's important. Legal is extremely important. Most legal documents get executed and then they get thrown somewhere and collect dust. And then, the people are scrambling typically to find them, especially as it relates to powers of attorney. But a POA, which is short for power of attorney, your healthcare agent and directives, your will and your trusts, which not everybody has a trust, not everyone needs a trust. But if there is one, you need to understand how those things work. Those legal documents are extremely important. I would say the POA is the most important document. And the healthcare directive is extremely important as well. These should be priorities for everyone. Of course, there's there's some requirements to be diligent on that too, but very important documents. If you take one thing away from this webinar, it's that these documents are extremely important. And not only are they important that you have them, but it's also important that the right person has the ability to act for you, right, that you trust. And the document has to give them the authority to act for you in all the different ways that you need them to act for you. Sometimes we've seen these documents, and so we ask the client, hey, you have power of attorney? Yes, I do. But then the power of attorney doesn't spell out all the things that the attorney in fact can do. And in that case, it's kind of worthless, to be honest with you. So you need to have these documents, but you need to have the documents need to be sound, and you need to have the right people in place to act for you, because there is a level of trust that's required, because you're really giving your attorney in fact the powers to do everything that you can do. Okay, so if you think about that, they can take out money, they can pay bills, they can really do anything that you can do for yourself. But it's important, especially when you can't do for yourself. So, but most of the time when you see an attorney, they're gonna address all these. Estate planning attorney will address all these documents as part of the package. Healthcare agent and directive is really about what you want to see happen. And when you're at end of life, typically, and it oftentimes called living will, your POA which oftentimes talk about durable power of attorney, which basically says this person immediately can do everything that you can do. A springing power of attorney says this event has to happen. So for example, a doctor has to say you don't have the ability to act for yourself in order for a springing POA to say now this agent can act for you. I don't see many of those just because oftentimes it's difficult to get the documentation for that to happen, but it is something that you can do if you're worried about giving someone the keys to do everything for you right now. I'm not really going to talk about Medicaid asset protection plan. That's really a plan that does take a long time to try and spend down or gift away assets so that someone can qualify for Medicaid. I'll just tell you to be very careful of that, and it's not nearly as easy as people think it is. And whoever it is, the person who's the donor, in other words, the person who's giving or spending their money and giving it away, know that is irrevocable, right? So if you start that process, you can't undo it. So we're not big fans of Medicaid asset protection plans. I've seen them done, but most of the time we're talking about how we use our clients' resources to pay for their care. So an estate plan needs to be reviewed if you have one, needs to be created if you don't have one. Documents need to be obviously reviewed and updated. If the last estate plan was done 20 years ago, you perhaps need to update it. We typically talk about 5-year kind of reviews with your attorney to see if anything's changed and make those changes. So moving on to financial, right? We're financial planners. It's stuff we talk about all the time. What are your sources of income? What are the expenses? What are the assets and the liabilities? And who are the people that are involved that are the professionals, right? So this is a list of your income, a list of your expenses. Same thing for people that are working versus not working. You have sources of income and you have bills. It's important for someone else who's coming in from the outside to understand these things so that they can ensure that bills get paid, and that assets are managed and that income sources are used for that purpose. Once again, assets and liabilities, the types of things that you can look for. Obviously mortgages and credit lines and credit cards and things of that sort. Taxes need to be paid on property. Those are the types of things that someone who's part of a care team needs to understand for the care recipient, right? You need to understand how the investments are structured. You need to make sure that they're appropriate. For example, if somebody has their investment structured in a way that's for growth, right, for retirement purposes, maybe when they were 10, 15 years from retirement, that's not the way their investments should be managed if they're getting ready to use them to pay for long-term care expenses, right? So there needs to be a matching of those investments for what those needs are. And if those needs have changed, then the investments need to follow suit. Often, a sound financial professional can help you with that. We obviously do that, but other advisors should be able to help with that as well. You obviously need to review your titling and your beneficiaries on your accounts. What that means is that, how are your accounts titled? Who are, and by that I mean, do you have POD or TOD? Is the trust, do you have a trust, but yet you don't have registration of an investment account in a trust? Those are important things. Your beneficiary designations are also important. You have your primary beneficiaries, which are the first in line, and then your contingents. So those need to be reviewed, and you need to make sure that those match up with the care recipient's desires, right? And I think a lot of what a care team is doing is protecting the recipient. So, I mean, you want to make sure that these things are known in advance, and then, some people will try and perhaps persuade people to change things. And that's the whole protection part, right? To ensure that nobody's trying to take advantage of your loved one. And unfortunately, we've seen that happen with elders. So as it relates to the insurance, annuities, pensions, investments, all those things typically have beneficiary designations. And once again, it's one of those things that people look at and don't, initially, maybe when they enroll in a 401k or when they purchase an annuity, or, they buy the insurance policy, and then years go by and they don't address it, right? Because it's not something they're thinking about. So it requires a review. Who are the professionals involved? Who is the accountant preparing the tax return? Who's the insurance agent, the estate planning attorney, the financial professional, people at the bank, all those things, right? If you're going to act as power of attorney, you have to know those people because you have to provide that document typically, and then you're going to have to deal with those people to ask questions, to make requests, so on and so forth. You need to understand the tax situation. This is where talking to a CPA is important. Also, a financial planner can kind of be the go-between here, right? Are taxes, are taxes being paid along the way? Are they paid quarterly? Are in-home help or proper taxes being withheld? That's typically a no. A lot of caregivers won't work unless you pay them cash. But that being said, all these things are important to understand. Are there tax benefits that are being taken advantage of because someone is a recipient of care? This is where professional help is really important. Understanding a financial plan and a monthly budget, right? A monthly budget. Now that we have care expenses, how does that impact the monthly budget? How do we ensure that there's withdrawals that are coming from certain accounts to cover these extra expenses? Monitoring bank accounts is very important. We've uncovered a lot of fraud there too, where once again with elder fraud and elder abuse, people trying to access bank accounts. So having some sort of mechanism to monitor bank accounts is really important with care recipients. Personal aspects. What are the living options that appeal to the person receiving the care? Most want to stay at home. Moving with a family member is an option. Moving to a retirement facility, independent living, assisted living, or obviously at some point some sort of spectrum to full care potentially. Looking at the different public benefits, AARP has a good resource on this. The different public benefits available, oftentimes for veterans. There's a lot of different provisions in place. So going on to AARP makes a lot of sense. And then, having a letter of instruction. Once again, we're planning in advance, right? We're of sound mind when we're thinking about this. Write it down. What do you want to see happen? Make sure your loved ones know about it, right? And then, do you want any charities to receive assets? How do you want to sort out your tangible assets amongst loved ones? Usernames and passwords for your digital accounts, and then final arrangements can be things you can write down. And then where do you secure these things? Where do you keep all these things? Who knows where they are, right? That's where that communication is also important. We have a digital vault that we create for our clients to where we have digital copies of these things. And sometimes that's also helpful in events where your loved ones have to access these documents. So number 3, the impacts of caregiving are really, we've talked about the financial, we've talked about the legal, we've talked about some of these other components, the emotional component of this and the impacts of the entire family. That also needs planning, right? Being a caregiver is a stressful occupation, mainly because whoever's providing that care is also probably doing something else. They're probably also caring for children, working, dealing with their own responsibilities on top of caring for their care recipient. A lot of people in this country provide care. That's only going to increase as the population increases. And surprise, surprise, most of the caregivers in this country are women, as they are more reliable than men. So your plan must address how caregivers can get help, right? The demands on personal time, the loss of income if there's less working for themselves involved since they're helping you, stress at home, just burnout and emotional impacts. There's been a lot of studies on the emotional impacts of caregivers. It is very real that depression, anxiety, really reduction of their life expectancy can occur because it's a stressful occupation, right? So how do we deal with that? You have to stay on top of your health if you're a caregiver. You have to have some support. That's the whole idea of a team approach. You got to take care of your mental, physical, and social. And there are support groups available. There's also professional help to help organize and kind of help those things, like the care manager, visiting nurses, in-home aides, adult daycare. Caregiving support can help with a lot of those different things, doing some of the heavy lifting, negotiating bills, finding nurses and therapists. It's a lot of work. The errands, the cooking, all those things. And then technology can really help, right? If you are a caregiver or a loved one, the personal emergency devices, if you're not there to oversee your loved one, the medication reminders, the video conferencing and check-ins, and Alexas and things of that sort. And then obviously the digital vault to know about prescriptions and patient and all the different digital health records now, to where you can see what occurred during that medical visit if you need to follow up on it. Our advice to most caregivers is to keep your job if you can. To inquire about family medical leave if you do need to take extended leave, but still, gives you the ability for you to keep your job, and maintaining communication with your employer while you're providing this care. So key number 4 is a team approach. It can be very overwhelming for one person. That's why having multiple family members and team members can help with that process. And you don't want to try and do this alone. So engaging your family members, engaging obviously the people receiving the care, siblings and loved ones, and then outside emotional support. A lot of different professional advice is available. Certified financial planners like us, attorneys, insurance providers, your accountant. Typically an accountant that's worked with someone for a long time really understands a lot of their financial situation. And then you could have a care manager involved as well. So those are your 4 challenges, right? Do some smart planning on the front end, which will make the eventuality of needing care or providing care much easier to deal with. Your plan must address medical, legal, financial, and personal issues. Understand the impact to the other people around in the family, and especially the caregiver or the coordinator of the care in the family. And then make sure that there is a team approach, right? It takes a village. We say that about raising children. It really applies to providing care and looking out for our community members, right? Their neighbors, there are people willing to help. That's what we, as society, that's what we owe to our society members as they age. So start building a plan now, right? It's at age 60, that may not happen, but have these discussions. If you're a child, have these discussions with your parents. If you're a parent approaching needing care, have the discussion with your children, so that more communication is always better. And start gathering some of these documents. We do a review. We're happy to have this conversation with you to see if there's any way we can at least help point you in the right direction. Anything you do to try and plan in advance for something like this is going to help at some point. Maybe not initially, but it will. And we'll provide some action steps to you for your specific situation if you want to have that conversation. You can email us, contact us if you want to have a conversation about it. Obviously, this webinar will be on our website if you need to access it, and we'll have more material. I think our newsletter this month has some pretty good articles on caregiving. You might want to check that out, and stay tuned for more webinars in the future. And we appreciate you, and we'll talk to you next time.